Good afternoon. I am going to talk about hospitals. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron. The Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patient and illness, except pediatrics. We have a specialist hospital for that in another part of Edinburgh. The hospital for sick children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the intensive care unit, ICU, and the surgical high dependency unit, HDU. Jordi, what does outpatient mean? Dr. Barrow. Dr. Barrow, outpatients are the people who come to hospital to attend a clinic or to have test or treatment, and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards, and of a patient's treatment requires only on 1 day, such as simple operation. They can be admitted to the day surgery unit. Okay, outpatient. Dr. Barham, the accident and emergency department, A&E, also called casualty, is where patients who are acutely ill with a certain serious condition come for assessment or treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient department, OPDS. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient problem. Inpatients, Dr. Barrow, the inpatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need. As in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill. For example, with suspect myocardial infarction, or they are seen in the A&E department where the doctor on duty working at that time arranged the admission. This will happen in this case of a patient with a fractured neck or femur. For example, large hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed. Dr. Barrow, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP care. Thank you. Good afternoon again. I'm going to read the exercise. 9.1. Complete the table with a word from A, B, and C opposite. Put a stress mark in front of the stressed syllable in each word. The first one, admit, known, admission, assess, assessment, discharge, operate, operation, refer out, treat, treatment. 9.2, make word combinations using a word from each box. Waiting list, acutely ill, assessment unit, referral letter, on duty. 9.3, which hospital department will be most appropriate for following patient? A woman in diabetic coma, intensive unit. A patient who has just had a radical prostatectomy, HDU. A patient who is to have a skin lesion removed, dermatology. A man with a foreign body in his eye, ophthalmology or A&E. A woman with a threatened abortion